Well, everybody, good morning. It's great to have you here. And Cara, thank you for helping me. And I'd like to thank my team. And I'd also like to thank you for joining me today. We're going to have a very dynamic, exciting time together. So, the theme today that I'm going to be sharing with you is the eyes and the lymph system. Now, the lymph system is something that's getting a lot of attention today because the lymph system is very connected to our immune health. And of course, we're dealing with the COVID virus, and a lot of my colleagues, especially in functional medicine and naturopathic medicine, we're all talking about how we can boost our immune health. Well, it just so happens that our eyes also have their own lymph system and immune system. I discovered this about 20 years ago, and I was, just really experimenting, but I had just finished my craniosacral training, and I was thinking about a patient that I was working with who was diagnosed with cataracts, floaters, dry eye, and I started counseling her on how to improve her lymphatic health. And within 3 months, the floaters had gone away, the cataracts had reduced by about 50%, and her dry eye had also reduced as well. So it really awakened me on the connection between our lymph health and our eye health. And today, what I'm going to do is I'm going to take you through 3 protocols that are going to target the eye lymph connection. And I want to say that anything that I show you today in terms of PowerPoint presentation or anything that I'm sharing, yes, you will get a recording, but also there'll be some handouts for you as well, written handouts. So we will send all that at the end of our session today. So before we go into protocol 1, I thought we'd have a little fun. And what I wanted to do is I wanted to send you a poll. And the question is about your recent eye exam. And I find this helpful when I teach workshops. And it's a really simple, 2 choices here. What was your latest experience with your eye doctor? Was it satisfying or was it unsatisfying? So, well, if you feel like you want to answer that, by all means do. When you go for an eye exam, it's really an interesting process because usually you're sitting in a dark room and the doctor is flipping lenses, which is clearer, 1 or 2. And usually it's a pretty quick examination, and usually you have no idea what lens you might choose. So you choose number 2 and you get the lens and it doesn't feel quite right. And you go back to the doctor and he or she says, "Don't worry, you'll get used to it." Well, as I'm involved with the body and somatic therapies, that is probably the worst thing you can do to yourself, to force yourself into wearing something where it makes you dizzy or nauseous. And so I share this poll because I've done this in my live workshops, and a lot of times people are frustrated because their worldview is very different than their doctor's worldview. And just a little, piece of advice that in our overall health journey, it's really important that you find professionals who share a similar perspective or attitude. And they're out there, whether, again, it's in holistic medicine, acupuncture, naturopathy. I mean, there are a lot of different choices. And I'm kind of the representative in the eye care field. So we've got our poll, and 83% voted 70% are unsatisfied, and 30% were satisfied. So we're not surprised by that. Okay, let's move to, I'm going to share my screen now, and we're going to go through a short presentation on Protocol 1, and we're going to use the aromatherapy essential oils as part of our stimulant in improving our lymph system as it relates to our eyes. So you will get a copy of this presentation, so I'm not going to read it, but what I will say is that those of you who sent a questionnaire back to me, I would say that I can confidently tell you that all the conditions that you're dealing with, there is a thread of a lymph stagnation issue. You know why? Because we're sitting at our screens all day and we're not getting out and we're not getting enough exercise. So this picture represents, these eyelids represent a major lymph area in the eyes, and we have glands here, and we also have a gland here that produces the tears that moisturize and hydrate the cornea. So those of you with conditions like meibomian gland dysfunction, chalazions, styes, or just dry eye syndrome, it starts with an inflammation that's going on here. Now, why do we have that inflammation? Take your pick. It could be inflammation, it could be toxicities that you've been exposed to, it could be stress. And I know many of you in your questionnaire talked about stress, and I'm going to show you some techniques to not only remove your eye stress, but also your body stress. You know, in working in the somatic field, what my colleagues tell me is that 80% of body tension is carried in the eye. So I'm going to say that again, 80% of body tension is carried in the eyes. This is amazing because usually what happens is we develop this stress pattern and we have absolutely no way to discharge it. And if we look here, we've got the cornea, we've got the lens, and by the way, the lens should look white, and when we develop cataracts, there's metabolic waste that starts to accumulate here because there's no blood vessels that actually create nutrients here at the lens. Now, we go back here, and this is the posterior part of the eye, the posterior 2/3 where we have vitreous floaters. And one of the big issues with floaters is this vitreous gel sac begins to shrink and pulls away from the retina. So again, lack of hydration, lack of water, lack of fluid. And then of course the connection here to the retina and the optic nerve, which could be related to things like glaucoma or optic nerve inflammation. But it all comes down to how are the waters in our eyes flowing? So again, I'm not going to go through specifically this slide, but we know that in floaters, if we can create better collagen health, liver and eyes definitely connect on a Chinese medicine level, we can dissolve the floaters. So here's a picture of the back of the eye. This is the retina. This is the macula right over here. This is the optic nerve. This is the fiber optic pathway of all the arteries and veins that travel to the brain. So this is a sea of microcapillaries, small blood vessels. And in the microcapillary health, one of the things I'm going to target here is something called nitric oxide. And this is an ingredient that acts as a vasodilator. It's, again, a lot of functional medicine doctors are talking about nitric oxide as a vasodilator. Well, in terms of the microcapillary health, we need nitric oxide, and we usually don't get enough great way to do this is through beets, garlic, citrus fruits. I'm a firm believer that food is medicine, and I'll give you another statistic. The eyes and the brain make up 2% of the body weight and use 25% of the food intake. Wow, that's a lot. So what we eat definitely affects our eye health, our brain health, and our systemic health. I'm going to talk a moment about astaxanthin. That's a marine carotenoid, and it's really protective of our macula, but it's also really important for our overall eye health. And I've done a lot of video blogs on astaxanthin, and I just want to spotlight that for you. So again, protocols for eyelid health. I'm not going to take time on this. Protocol for cataracts. But what I want to get to now is our aromatherapy protocol 1, and we're going to bring in Japanese acupuncture in the ears. Now, I just want to say we're not going to be putting needles in our ears today. No. But the point is that our ears represent a very fertile part of the meridians, the acupuncture meridians. And specifically, this aromatherapy protocol uses 2 techniques. One is called ear massage on the earlobe, and we're going to massage below the earlobe on the neck. This is called the auricular massage. So I've got pictures to show you. There are 2 essential oils that I really like to use in this. The first is called spike lavender, and the second is called laurel leaf, bay laurel. So I'm going to talk about those for a second. Spike lavender is from the lavender family. It has antibacterial, antiviral, that's important, decongestant and relaxation characteristics. And laurel leaf is actually called the queen of the lymph system. Laurel leaf also has antiviral properties. It's a great tonic for the kidneys and reproductive system. So what you're doing here is you're going to be massaging on the eyelid, the earlobe here. And as you can see in the slide, these are actually eye points, face and inner ear. The inner ear is part of our vestibular system. That's part of our balance mechanism. And again, if you want to go further in the relationship between our vestibular system and our visual system, they're married. They're really, really related. Another reason why we develop eye problems is because we have poor dentistry. I can't tell you the number of people with mercury amalgams, with root canal history, and how that relates to things like floaters development, cataracts development, and so on. So in this particular technique, and it's not that we're going to do this now because you didn't know about the essential oils, the technique is that you're going to use 2 drops, 1 to 2 drops of your spike lavender, and you're just going to be massaging it in this particular area, maybe for about 30 seconds. What I like to do, and when we're done with the PowerPoint, I'll show you exactly what you're going to do is you're going to massage both earlobes with the lavender, and then 1 to 2 drops of the laurel leaf on top of it. We call that layering. And again, you're going to massage it into the earlobes. Now, the second part of this, we call the auricular massage. So this is a major lymph channel, huge lymph channel. Carotid artery is here. Also, the vagus nerve runs in this area. So when you do the same technique, you do the spike lavender, couple of drops in this area, both sides of the neck, what happens is you're going to just massage that area, and it's going to open up your lymph system. So this particular technique is fabulous for stimulating the lymphatic health. So I know I didn't tell you to get these essential oils, but I'm just going to demonstrate this right now. So here's my lavender oil, couple of drops. You don't need a lot. And then you're basically just massaging on the outside like this. And you can do it sitting up. You can do it lying down. If you want to practice right now, I know you may not have oils with you, just take maybe about 30 seconds and just massaging this area stimulates the acupuncture meridians, and especially down here, you're going to get the eye points working. Okay, so you do the lavender first, and then here's my second. This is laurel leaf, which is an amazing lymph. Again, the same thing. So you're just layering it. You know, I have an acupuncture colleague, and before every acupuncture session, she's not a Japanese acupuncturist, she will do it's essential oils ear massage for a few minutes to relax her patients before she puts the needles in. And I've actually personally experienced this, and this is going to really balance your nervous system and your fluid body. See, we're made of electricity, that's the nerves, and then we have our fluid body. So when you start doing this kind of massage, it's going to activate those things. Now, the second part of this is the auricular. So this is lavender. I'm just doing this on both sides, and I'm really massaging. Couple questions about where you can get the oils. I'll talk about that in a minute, and I'll also send you a handout. So I'll address that in a moment. So again, there's the lavender, and then this is the laurel leaf. Now, if you feel like you're getting a cold, if you feel like you're getting a sore throat, doing this auricular massage is a wonderful way to perhaps move that illness out of your body. I always love using auricular massages whenever I'm not feeling well. So that's the game that I want you to do. That's protocol 1. Now, in terms of questions, where to get the essential oils, this is the $50,000 question, because you know, aromatherapy is an industry now that is very competitive. And the one thing you need to be very careful about, and what I like to do is I like to find companies that use organic, they're wildcrafted, they're using biodynamic farming. You know, I would say a mainstream company that does it pretty well because of their consistency is doTERRA. I would say that would be a place to start. But there are 2 small companies that I use. One is called LG Botanicals, and the other is called Original Swiss Aromatics. And both of those are small companies. They're not MLM, multi-level marketing, and you would be able to get these oils from them. But the bottom line with aromatherapy is you may need to experiment with different essential oils, because a lot of it depends on your personal energy and how it affects you, how you feel, your vibration. So with the essential oils, you might have to experiment. A couple things about essential oils. First of all, they're very high frequency. I mean, in other words, vibrational healing is kind of the future medicine now. And in frequency medicine, whether we're doing homeopathy or herbs or essential oils, color therapy, which we're going to do in a few minutes, vibrational healing works specifically on each individual based on what they're bringing to the table. And we call this an adaptogenic characteristic, meaning that if I give 10 people spike lavender, based on what they need for balance, that spike lavender is going to help each person individually. There's a certain biointelligence that the plants have that will help us come to a deeper balance. So what I'm talking about is a wellness model. I'm not talking about treating symptoms. You know, in eye care, the eye doctors are constantly treating symptoms and chasing symptoms. And as you get to know me, some of you have worked with me for a while, is that I offer different things that stimulate your own body's intelligence for healing, and especially in the eyes, because a lot of the things we've been told and a lot of the ways we've been treated in the eye doctor's offices actually take us further away from our ability to heal our eyes. But I'm here to say, doing this over 30 years, it's close to 35 years, that my patients are all getting better. Now, there are a few that, yes, they need to go get cataract surgery. Or I have a lady right now, I've worked with her for a couple of years, but what we did was we set her up in a way where she went and finally decided to get the cataract surgery. She sailed right through it. We're doing physical therapy afterwards. So she's integrating the lenses that have been put in her eyes. So it's not always a failure if you have to go for eye surgery. It's a small percentage of my patients, but sometimes the healing is doing the surgery. And, you know, I need to say that because everybody's body is different and we're all on our specific journey for health. And sometimes, you know, we don't know exactly what the answer is. Okay, let's see here. Let's see. So somebody is asking about dosages for kids. I would say start with 1 drop of each. Another technique you can use if for some reason you're getting sensitivity here is just putting it on the soles of your feet. And this is a way that you get it into the bloodstream. Or you can put it on your hand and really rub it. You can see how I'm doing it. So you're kind of diluting it and diffusing it if you're really sensitive to the smell. So those are some strategies that we use. You know, animals definitely like essential oils, but they're so strong that sometimes what we have to do, what I used to do, is I would take a drop and just put it on my dog's blanket, and that would relax her. So another one is asking, is spikenard the same as spike lavender? No, spikenard is a root. It's a very different essential oil. Sometimes it smells like dirty socks, so it's an amazing shamanic essential oil. But spike lavender is something that you can carry in your first aid kit, and it's great to have as an antibacterial agent. I've used it to actually reduce shock and trauma. And also, my wife one time, she cut her finger and I poured about 1/3 of the bottle on that finger, and within about 30 seconds, it stopped bleeding. Now, it was an amazing epiphany because we were out in, you know, hiking somewhere. So essential oils can work really well on a lot of levels. All right, I want to move more to the eyes now. And this next practice, this is practice number 2, is going to be about working with our eyes. And we're also going to be working with a sound. Now, again, some of you who have worked with me before understand this, but those of you that haven't, what I have discovered, one of the best ways to reduce compression in the eye tissue is by applying sound there. And the thing about sound is there's different sounds that activate different aspects of our anatomy. There's a sound that actually can activate our bone marrow. There's a sound that can activate our connective tissue and fascia. So this particular sound we're going to use, we're going to work with the bones around the eyes. This is the orbit. And what we're going to be doing is we're going to be opening up the circulation in our eyes. Remember I said that, 80% of body tension is carried in the eyes, and we haven't really learned how to release that tension. So the sound we're going to do, this is from the work of continuum movement, and it was invented by my friend and mentor. She passed away a few years ago, Emily Conrad. If you want to learn more about continuum movement, I highly recommend her book, Life on Land. It's an amazing process. And to me, it really activates what we call the fluidity inside of us. When we're born, we're 90% fluid, and one of the aging issues is we dry out, right? We're supposed to be about 70% fluid, and our eyeball is mostly made of fluid. So a lot of the problems that we have are related to the fact that our eye is drying out. I could go through the list: dry eye, cataracts, floaters, macular degeneration. And then when we wear strong lens prescriptions, that creates a compression in the eye tissue. That's going to create another dehydration. And then if we add on top of that toxicity, stress, trauma, inflammation, well, no wonder there's so many eye problems today. So this technique is really simple. What we're going to do is the sound that I want to show you is called the Jacques sound. And it's basically, there are two parts to it. There's a J-I sound, J, and a Z-I sound, Z. So I'd like you to try that right now. J, Z. Try that. J.
Je.
Yes. Good.
Z.
Yes. J. Z. Now, what I want you to do with the sound is I want you to make it a little more connected, and then you can go fast, you can go slow. So I'm going to demonstrate it. So it sounds like bees buzzing. And when we have our classes, our live classes, when either here or in my studio, it feels like we're in a beehive. But what that sound is actually doing is it's opening up the circulation around the bony area of the eye. Now, our eye fits in an eye socket, and there's 6 muscles that attach to the eyeball. And when we develop eye strain and eye fatigue, and there were a lot of concerns about that in your questionnaire, this Jacques sound helps release the tension in the eye muscles and the eye tendons that connect to the bony part of the eye. Now, when you're doing this Z, I want to give you one more piece to it. In Eastern philosophy, the J-I sound is called shining, and the Z-I sound is called dignity. So what you're putting into this area is something called shining dignity. That's pretty cool. But even if you don't want to remember that, the way this practice goes is you're going to be using both of your fingers here, and I'm going to demonstrate it. So just watch for a minute, and you'll get the value of the sound because we're all in a field together. And so as I make the sound, it's activating this for you, and you don't even have to do it. So just watch for a minute. My eyes are closed. I'm taking a little baseline here on how my eyes feel, how I feel, and then I start kind of at 12 o'clock, right on the bone, right on the eyebrows. So you get it? Really simple. All right, I'm going to guide you through this. So what I'd like you to do is I'd like you to close your eyes, sit comfortably, and while your eyes are closed, I'd like you to take your fingers, starting at about the eyebrows, And you can go, let's go opposites. So like I did, go all the way around. And I want you to make the zzz, and I'm gonna unmute you so we can hear each other.
Uh-oh.
Yeah, so when you're ready, let's start.
Okay.
Excellent. Eyes are closed, so really slowly. Okay, you can stop for a minute and you can just put your hands on your lap, and I want you to close your eyes. And I want you just to feel and sense and pause. We call this open attention. And this is a really important part of the process. I want you to sense and feel. Okay, so I want you to open your eyes. And tell me how you're doing. You can write in the chat box if you want. Are you seeing things any differently? More clearly? Okay. So what I'd like to do is I'd like to try it again. And this time I want you to go a lot more slowly. So I'm going to give you an equation here. Movement equals nourishment. Nourishment equals movement. And the movement we're doing is this. This time I want you to go the opposite direction, but I want you to do at least 5 or 6 jacques in going around. I don't want you to go fast. I want you to go slowly. I want your eyes closed so that you can go more internal. And I'm going to unmute you again. And let's do it. So we'll start here. I want your eyes closed. I want 5 or 6 jacques, shining dignity. Excellent. All right, you can bring it to a close. Bring it to a close. And I want you to again close your eyes. You can put your hands on your lap if you want to, and we're going to go into open attention again. This is the art of listening to yourself. What's your body saying? What are your eyes saying? What are you sensing? What are you feeling? It's just an acknowledgement. Okay, you can begin to come out of relaxation. That was really good, everybody. Awesome. So that's a warm up for the next part of this protocol, number 2, working with the eyes. So this next part, what you're going to do is you're going to be working with your open eyes, and you're going to need to use your thumb. Now, what's going to happen here is, just watch me for a minute. I'm covering my left eye, and I'm putting my thumb out there at about arm's length, and I'm just going to very slowly go in a circle, and I'm going to follow my thumb all the way around. While I'm doing this, I'm aware of my body. I'm breathing, I'm feeling my sit bones. Okay, and then I close both eyes and I make a comparison on how my right eye is feeling versus my left eye. And I can tell you my right eye is feeling a lot bigger. It's a lot more relaxed. And then I would repeat with the other eye. So I'm going to talk you through this. What I'd like you to do is, your eyes are going to be open this time. You're going to cover your left eye. You're going to hold your right thumb out there, somewhere around arm's length, whatever's comfortable. And I want you to slowly begin to move your thumb, and I want to emphasize slowly. While you're moving your thumb, you're aware of your body as you go around. The slower, the better. The slower, the better. When you go slowly, this tells the nervous system to relax. You know, electronics is about speed. This is the opposite. We want to give this kind of food to your eyes. So once you've gone around in one direction, then go in the other direction. Again, we call it see, feel. You feel your body while you look with your eye. It's very important to include your body's sense whenever you use your eyes. Now, once you get back to the 12 o'clock position, what you'll do is you can let your left hand go down into your lap. You can close both eyes. And I want you to make a comparison right now between the right eye, which you just worked out, and the left eye. And whatever you note is okay. It's just to acknowledge and create a relationship with your eyes on a feeling level, on a somatic level. So there's probably some insights coming here. Take about another 5 seconds or so, and then you can open both eyes. And we'll now have you cover your right eye, and you're going to use your left thumb. And now you're going to go in a circle. Again, I want to emphasize slowly. You can play with looking more detail at your thumb, the wrinkles of your thumb or your thumbnail. Can you also be aware of the peripheral vision? Go all the way around. When you get to the top, you can reverse it. Again, you can look with more detail, with more intensity, with less intensity. So play with that. Excellent, excellent. Good. Really good. When you're done, you can close both eyes. You can drop your hand, your right hand on your lap, and see if the eyes are balanced out. You know, one of the things that I want you to be aware of as you check in with your eyes is whatever is surfacing, meet it. There's no right or wrong here. It doesn't have to be a certain way or a certain answer. The answer is in you. And just to begin to make discoveries is the way to go. Okay, so I want you to open your eyes. I want you to look around. Just notice what you notice, if it's brighter, if you've got more peripheral, if you feel calmer. This is a great protocol for eye strain. It also helps with improving circulation, and it just slows you down. Now you're going to get a written report on exactly what I just shared with you, so don't worry. You'll have the video, but you'll also have the written part as well. All right, the last piece of this protocol is really simple. We've all done this before. I want you to rub your hands together. You're going to take the palms, cover your eyes with your eyes closed. You're going to breathe in through your nose, and when you exhale, I want you to make an M sound. I want you to do 3 of those. I'm unmuting you so we all get the sound together. So you do the M sounds on the exhale. After the third one, okay, after the third one, you can, eyes are closed, and just again, go into this open attention. This is your digestion time. Call and response. This is the response, your body, you're listening to your body's response. This will help you heal by taking this open attention time. I like to do it maybe a minute, 2 minutes, where I just listen to my body's response. Really good, really good. Okay, so what I'm going to do right now is we're going to do a poll, and I'm going to launch it. If you feel like you want to answer it, you can. What you notice: clear eyesight, eye relaxation, body relaxation. All right, so the results, okay, people are still voting. That's good. Um, the results are 13% experience clearer eyesight, 48% eye relaxation, 33% body relaxation, 7% other. So it's pretty incredible that in an exercise we did less than 5 minutes, um, our eyesight got clearer. That's the potential you have if you take the next 30 days and you really dedicate yourself to doing the, the the earlobe massage and the auricular, and then the second exercise, you will create a momentum where your eyesight is going to get clearer. If you wear glasses or contacts, they're going to become too strong for you, and you may need to go back to your eye doctor to get something less. And if you're suffering an eye disease or a serious eye problem, if you can do these exercises, the eye relaxation and the body relaxation are going to create better circulation. And this is the key. This is the way you do it. So I, you have the answer right here. This is it. All right, we're going to go on to the last protocol, number 3. And let's see here if I can find it. Hold on a second. Give me a moment. All right. I think we're good. All right, So we're going to do color therapy right now. This is part 3. You will get this this slideshow, and we're going to do 2 colors today: blue, green, and purple. So what I'd like you to do is I'd like you to look at this color right now. And as you look at the color, I want you to be aware of your breathing, and your eyes are now more opened up, that when you look at this frequency, this is a frequency about relaxation. This is a frequency that is about reducing inflammation, reducing pain. And when you get this slide, after the class, you spend somewhere about 2 minutes looking at this color and the next color. What color therapy does is it actually stimulates the retina to activate more of the photoreceptors. And the more photoreceptors we're using in our retina, the more of our eye we're using, the more vision we're using. This also has an impact on all the tissue of the eye. What I'd like everybody to do right now is cover your left eye and experience the color with the right eye, what you see and what you feel. Those are the 2 questions you're going to be asking yourself. What do I see? What do I feel? Once you feel you've got an answer, then cover your other eye. It's probably going to look a little different. What do I see? What do I feel? So you can do it with both eyes, or you can do it with each eye separately. I recommend both techniques. And then slowly take your hand away, and now you're recalibrated. So we're going to go to the next color. This is a indigo violet. Again, what do I see? What do I feel? And cover your left eye.
Already.
Notice how that lands in you. Uncover. Cover the right eye. Excellent. And then reintroduce both eyes. All right, you can take a break. Take a break. And just reflect for a minute. How you see the world, how it feels in your body. I keep reminding you to come back to, I'm doing the exercise, and then what am I seeing and feeling? So I'm internalizing the exercise. This is a key point I'm going to share. You know, there's all these eye exercise methods. The Bates method is probably the most famous. All of these eye exercises are mechanical, and unless you keep doing the exercise, you're not going to get lasting results. So the key in making a deep level change with your vision is to take the time to take it in, feel it. That's why I say, what do you feel inside? And I'm trying to wake up your body as it relates to your eyes. If you can do that, then the exercises, you're internalizing them, you're going to make a deeper level, longer lasting change when you do this 30-day program. All right. The last part of protocol 3 is a bit of a somatic meditation. And I'm going to guide you through this. So I'd like you to sit comfortably, and I want you to take 3 deep breaths. Just easy breathing. You don't have to hyperventilate. After the 3rd breath, I want you to take some awareness into your feet. So I want you to feel into the bottoms of your feet. And we're going to play with a little bit of pressure. So what I'd like you to do is maybe give your feet a little more weight and then give them a little bit less weight. And you may need to rock back and forth. I'm going to give you a secret here. And the secret is that one of the ways to improve your vision is to have better foot and feet awareness. Be in your feet more. So right now you're playing with touching your feet on the ground. The weight is changing. And the idea is feel your feet into the ground and then feel the ground coming into your feet. So you're playing with, I'm touching and I'm being touched. I'm touching the ground and I'm being touched. This is a very simple give and receive. You know how all of us are always giving and there's no receiving, and we're all depleted. And that's why our eyes let us down, because there's no receiving in our eyes. So what we're doing right now in our brain is we're using our feet to learn about, I can touch the ground and the ground is touching me. It's kind of like saying, I can see the world and the world sees me. I'm seeing and I'm being seen. There's a metaphor there. And if you're able to see and be seen, your eyes are going to heal. The reason why our eyes let us down is we're spending all of our time in the seeing. So the give and receive. All right, so that's the foot practice. Now, I want you to take your hands and I want you to put them under your armpits. It's a major lymph area, okay? And what you're gonna be doing is you're gonna be moving your hands down the sides of your body to your hip. But while you're doing that, I want you to make a sound called an E sound. E, and I want you to feel the corners of your mouth as you move your hands down. E. I'm unmuting you. E. Go slow. Nice. Once you get to your hips, you're going to come back up. All the way to the armpits again. Beautiful. All right, once you get there, that's good. I want you to take your hands and just put them over your eyes. There's no sound, and I want you just to rock a little bit, back and forth. So we're now in open attention. Notice if your body wants to move in a certain way. Maybe it wants to rotate. Maybe it wants to move up a little bit. One other point, while your hands are over your eyes, let the eyes float in your hands and in the eye socket. And you can practice that touch and being touched. So your palms are touching the eye sockets and around the eyes, and the eyes are touching the palms of the hands. That's that give and receive. Beautiful, everybody. Beautiful. Excellent. Okay, you can begin to transition, and you can let your hands down. Open your eyes, and you can just look around, see how you're doing. You should be feeling pretty good right now. So I want to spotlight this movement and why we're doing it in the E sound. So first of all, this is a major lymph area, right? And when you're sliding down the side of your body, you are stimulating major lymph. And the E sound spreads tissue. Remember I said certain sounds affect the body differently. So we had the Jacques sound, which was the bones. The E sound is a lateral spread. So you're laterally spreading using your hands, and you're using the E sound. Remember the corners of your mouth. That's going to help spread the face and the eyes. So you can do 5 or 6 E sounds as you go down, and 5 or 6 E sounds as you go up. In other words, slow down when you do this. You can even be like a bird and move your shoulders and arms if you want to. So we can bring in the nature spirits in this. I call it species inclusivity. Now, you don't have to do that, but that's like wings, right? Now, once you go up and down, and you can put your hands over your eyes, you're in what we call open attention. And this is where the fluid body, the lymph, gets to receive this stimulation that you've done. And open attention is that pause that I want you to start taking in the stimulation that you're doing in all of these exercises. Because what's missing, I feel, in a lot of the healing practices is there's no pause. There's no rest and settle. You know, if you go into a yoga class and you're doing one posture after another, or you're in an exercise program, there is no opportunity to metabolize and integrate the stimulation that you're receiving. But it's the stimulation that you're able to digest and receive and metabolize that's going to make the deep level changes. I would almost say that the rest and settle part of this whole program is going to get you to the finish line and help you recharge, reduce eye strain, bring more nutrients to your eyes and your body than almost anything else you could do. And that's a key point. All right, we're coming down towards the end. And I want to kind of recap and make sure you've got what you need, and then we'll open it up for questions. So there's 3 protocols today. We're really addressing the lymph system as it relates to the eyes and the body. So with the protocol 1, remember we're doing the earlobe massage followed by the auricular massage, and we're using 2 essential oils. We're using the spike lavender followed by the laurel leaf. 1 drop each. You're layering it. You're doing 30 seconds to a minute of the earlobe massage. And the earlobe here, this is going to activate the eyes, the teeth, the face, the vestibular, and the auricular. This is major carotid vagus lymph. So that's number 1, protocol 1. Protocol 2 is the Jacques around the eyes. Go slowly, 5 or 6 in each direction. Then going into open attention. And then doing the thumb rotation. Okay, and that's eyes open, each eye. Make sure you pause and you compare how your right eye feels versus the left eye. Take your time. Obviously, you want to do this without glasses and lenses. Okay. Then protocol 3 is the color therapy, which you'll be getting the blue-green followed by the purple. 2 minutes each. You can do both eyes or each eye separately. And then you're going to do the lymph stimulation from the armpits down to the hips and back up using the E sound. And then you're doing the palming. So my suggestion would be to do these protocols for 30 days. I'd like you to do it for 30 days. This is a 30-day challenge. And you can send me emails. We'll be in touch. I'm happy to respond. And let's see what kind of changes you can make. You know, we've got all kinds of things like eye drops and eye vitamins and all of those kinds of things. And, you know, that's all on my website, on my video blogs, all of that stuff. But this is really targeting an essential part of our eye health, and that's the lymph system, which is part of our immune system. So that's kind of the program. And I think right now what I'd like to do is open it up. If you've got any questions, you can either do it in the chat box or you can raise your hand and you can come on live. Whatever you feel like you want to do, I'll hang around for a little bit and let's see if there's any questions. Somebody is asking about an eye drop called Oculomed, which is an eye drop that has glutathione and vitamin C. And if you have cataracts, the protocol is using the MSM drop followed by the Oculomed eye drop 3 times a day. So that would be the protocol there to continue. Let's see here. Got a question. Oh, sorry. See, Susan, if I can get you on here.
I'm unmuted now.
Okay. Oh, good. Okay. Wonderful. So what's your question?
Well, first, thank you for this presentation. It's actually very helpful. I'm taking this for my daughter. She's a high school student, and her eyes really, she got a prescription for the first time last year after her junior year because it's very stressful in school. So I'm going to do these exercises with her, but I also want to know if you do private consultations as well. If that's, we live in California, so I just know if that's a possibility. as well. And then what would you recommend when you're in a very stressful situation, like when you're academically, challenged and time challenged? Would these exercises be enough, or is something more needed?
Okay. So in answering this question, number one, yes, I do telehealth, so that's no problem. This is an interesting point. The prescription you get from the eye doctor is based on 20 feet. And if you use that prescription for screen time or reading, it's usually too strong of a prescription. So you would want to wear something less for your screen time. Probably want to get some kind of a blue blocking filter. The exercises would all be fabulous for your daughter, depending on, how shy she might be about doing these things. Maybe if you do them with her, but these will definitely reduce eye stress. And there's a couple of other techniques. There's something called the 20-20-20 rule, and it's every 20 minutes, look up at 20 feet and do that 20 seconds. I think with children right now, with all the online school pressure, I think that we need to build more breaks, get out in nature, get out in natural sunlight, get into movement and exercise. That's really, really important. And of course, diet and, other things as well. So that would be kind of, a strategy in a direction that I would move. And hopefully we can get back to going to school sometime soon. All right, let's take our next question. This is from, Babette, you're on?
Hi, Dr. Sam.
Hi.
I have two questions. One is, I'm on the computer a lot during the day because I work for a school district. So I'm on Zoom probably 6 hours a day. And then the other 4 hours I'm on the computer doing other projects.
Okay.
So I do have prescriptions. I have my blue blockers.
Yep.
That I wear, even though it kind of looks a little funny to some people, but people always ask me what they are, and they are convinced to get some because their eyes are strained and tired because they're on the computer all the time as well. But I have my prescriptions that have bifocals in them. So what would you suggest? Because you were just mentioning that it's maybe too strong.
Yeah, so, the bigger the window you look through in terms of the glass, the more peripheral vision you bring into it and the more relaxation. So I don't like to use bifocals, prescribing them for digital screen time. And yes, you need to make sure you get a reduced prescription that's calculated based on the distance you're focusing. I have a lady right now where we took her out of progressive lenses. She's now wearing a single vision lens for her screen time, and her eye strain went down about 80%. So I think you need to get out of the bifocal and into the single vision, and maybe even incorporate the blue blockers in that, as long as you don't feel the weight is bothering you. But it's another filter, it's another lens that you're having to look through when you're doing your focusing. And I would build into the day a lot of at least mini breaks of doing some of these eye exercises. People are asking how many times a day. I might do them 2, 3, 4 times a day, even if it's just for 30 seconds or a minute, so that you're disrupting the staring and the trance that we get into with screen time, because we're making repetitive movements over and over again, and we need to break that pattern. And the way to do that is through the eye exercises. So again, we're rejuvenating. And it's that idea of seeing and being seen. Well, there's no way we're being seen when we're constantly on a doing mode with our exercises. With our screen time. So we need to build in the exercises to balance that out. So does that answer your question?
It does. So if I go to my optometrist and just ask for a reduced prescription based on the distance of focusing. So I'm probably, I don't know, maybe 2 feet from the computer screen. So he'll know
Yes, he'll know what to do.
what to
And
do.
then just
Yeah.
get a single vision lens. And this is for everybody. If you're doing a lot of screen time, try to use a single vision lens. Definitely don't use progressives. And I would prefer you don't use bifocal. Sometimes you have different distances that you're focusing, but any eye doctor would be able to come up with a lens prescription based on the distance you're working at. So yeah, keep in touch with me. That's great. Appreciate it.
Okay.
All right,
So should I get
go ahead.
up close glasses? Should I just get a separate prescription for reading?
Probably, but I would start with the computer glasses, and maybe you can tweak
Okay.
it so that you can use the computer glasses for your reading. So you could, again, during the exam, they could figure that out.
Okay. Thank you, Dr. Sam.
You're welcome. All right, I'm gonna just run through a few more questions. Somebody's asking about, does wearing masks make a difference in eye health? I definitely think that you should be taking your mask off, obviously not when you're around people and in big crowds, but what I've noticed is that people's eyesight tends to deteriorate because of the compression and contraction of the mask. So I would definitely track that as a way to don't wear the mask all the time. Another question about strength of MSM. Well, the 15 MSM is definitely the best MSM for removing floaters. And I can't say that it works in every case, but we've had a lot of success with the 15%. It's going to sting a little bit, but in the stinging, it only lasts a few seconds. And there's a video that I put on my web store which talks about how to titrate and get used to the MSM drops more slowly and more gently. So you could certainly do that. All right, we have a question. When you are in touch with your body, does that help direct which eye exercises you would do? What's an interesting question. I think for all of us, we're in the school of getting reacquainted with our body as it relates to our eyes. So I think it's an experimentation with the exercises that maybe there's one or two that's going to give you more body awareness. So I think it's very individualized, but certainly we are in the school of learning about our body, and that's what this class was about. All right, somebody is asking about the relationship between eye health and gut health. So the gut is about 70 to 80% of our neurological health, our immune system. And if we've got dietary absorption issues, inflammatory issues in the gut, that is going to affect the eyes. A few years ago, there was a book that came out called The Grain Brain. It was written by one of my colleagues, David Perlmutter. And so he talked about the inflammatory relationship between gluten, dairy, sugar, soy, as it inflaming the brain. Well, guess what? In utero, prenatal development, the eyes originate from the brain. So every tissue of the eyeball originates from the brain. So that same inflammatory relationship is going to happen in the eyes based on your gut health. So cleaning that up is definitely going to improve your eye health. If you've been exposed to mold, that could affect your eye health. If you've been exposed to pesticides, that could affect your eye health. If you have mercury amalgams in your mouth, that's going to affect your eye health. So strong relationship between what we eat, what our gut health is like, and what our eye health. Somebody is asking whether chiropractic care is helpful. Well, I think it depends on the chiropractor, their energy, the consciousness. I always say it's the consciousness of the practitioner that makes the difference in the healing. So it's less about the modality and more about the person's, the practitioner's sensitivity, gentleness, understanding what is enough in terms of treatment. So those are all factors involved in based on the modality. If you want to contact us, you can contact us through appointments@drsamburn.com, and you'll speak with Charlie, and she can help you with telehealth. Okay, so let's see here. Somebody's asking about the Atlas and C1 goes out of alignment. This is so related to eye health. The cervical spine and the Atlas, when they're out, they affect the eye muscles, and it can actually lead to things like double vision and eye focusing problems. I've actually helped people heal their Atlas and see cervical spine through cranial, and their eye prescription goes down, their double vision goes away. So there is a real interesting connection. All right, somebody's asking about BEMER therapy. So yes, I've done a lot of research with the BEMER. This is a PEMF mat and pad. And the BEMER is one of those instruments that actually helps improve the vasodilation of the microcapillaries. I do distribute the BEMER. I've done a lot of research. I have a lot of background with the BEMER. If you're interested in learning more about that, contact us. Again, at appointments@drsamburn.com, and I can share my research and the possibility of maybe using the BEMER to help your eye health. Okay, in terms of shipping blue blockers to Canada, we do FedEx. Contact us, and then one of my assistants can help you with that. Any suggestions for lighting, types of lights, light directions for workspace? Natural light is always better, full spectrum light. Make sure you have indirect light going on in the room and not darkness. Eliminate the glare that comes off the screens. Basically, if you're using screen time, I would recommend blue blockers. I think that would also be beneficial. Well, ladies and gentlemen, it has been an honor for me to be with you today. I want to thank you for joining us. It has just been really, really rich. Practice, do your daily exercises, and we'll keep in touch. Just so you know, I'm doing another class on October 17th. It's going to be very different than this one, so if you're interested, you can certainly sign up. So many blessings to you. Take care, and we'll see you down the road. Bye-bye.